Hi, I'm Susan Kelsey. I'm a geriatric care manager with Assistance Plus in the Hilton Head, Bluffton, South Carolina area. I'm here today to talk with you about enroll Medicare Part D plan for 2021. Even if you're not in the South Carolina area, I think you can follow along with this tutorial and learn how you might be able to do this on your own. First thing you have to do is go to the Medicare.gov website. Once you have that up, there's a little tab right there that says Find 2021 Health and Drug Plans. Click on that. That will take you to the next page. And on that page, you will be asked either to log in or create an account, or you can continue without logging in. For speed, I'm just going to continue without logging in. But if you want to save your information, I think you need to create an account or log in with your current account. And then if you don't finish up at one sitting, then you can go back and all your information is saved. Right now, though, I'm going to continue without logging in. To do first is my first question. I have to answer by saying that I want to look at drug plans. And then I am going to enter my zip code. I'm going to continue. And then it's going to ask me if I need help with the costs of any of these programs. I'm going to say that I don't need any help right now. Some of you may, and then you can check off which box is appropriate for you. But I'm going to go on to the next screen, and I am going to enter some medications. I have 2 already entered, but I'm going to show you how you can add another drug. So we have 2 generics here. I'm going to show you, I'm going to remove this drug and show you how to do it on your own. I'm going to call that drug Coumadin. I'm going to type it in. I'm going to add the drug. It's right here. I'm going to add that drug. And one of the things it does is it tells me that there is a generic available. A lot of your medications, you may know them by their name, and it is a brand name, but they're going to try to lead you to the generic equivalent. And you can do that, or if you have to take the brand name, then go ahead and say add brand name instead. So I'm going to add that as a generic, and now it's warfarin. And it tells me what the typical dose is. If I'm not taking 5 milligrams, maybe I'm taking 1 milligram tablets. I take them, and then you put in your quantity, 30 quantity every month. Maybe I take 2 of these each day. So now I'm taking 60 every month. They'll have a 2 milligram tablet. But some people may not want to do that because maybe they're told to take 1.5 some days. So they're just going to stay with the 1 milligram, saying that they take 2 a day, and this is what is going to come up for you. You can then add that to your drug list. Hitting this, add to my drug list. Now we have 2 medications here, and maybe we'll try one more drug. Let's put in metformin. And it's giving me different choices. I'm going to put in glipizide metformin, and I'm going to add that drug. I'm going to see what the dosage is. And I'm going to select this dosage over here. 60, so twice a day. That's what you'll have to put in. It's not just some of these tablets you'll be taking 3 times a day, every month. I'm going to add that to my drug list. So we're going to just have 3 medications that we're going to look at. So we'll just this on. If you had other drugs, make sure you have your list handy when you start doing this so that you can just put them in one right after the other. If you don't, it's okay. You can still add these drugs. Now it's going to let you choose your pharmacies. You have your zip code here, and then you put that in, and it will say find pharmacies. And here are my pharmacies. I'll have a whole list of pharmacies. I'm just going to put 2 of them in, just so we can compare. I'm going to do a CVS, and I'm going to do Harris Teeter. And these will both come in down here. You can, as I said, go up to 5. We're going to hit done, and it will give us the plans. Now, I have chosen to sort the plans. They're by the lowest, the one that has the lowest total drug cost plus premium cost per month. There are other ways you can do it, just by the lowest yearly drug deductible. In 2021, we had a deductible of $435, and in 2021, that will go up to $445. That means after you pay that much, you out of pocket, you will then go into the next stage of the drug plan. So looking at my plans here, the least expensive one for me is plan by WellCare Wellness, and it is a 4-star rated plan. I usually tell people that you should have at least a 3-star plan, and that's based on ratings by consumers. This will cost you $16.70, including all the drugs. It will be $240 a year. So that includes the drugs plus the monthly premium. That's going to give you your total cost for the year. This plan, instead of having that $445 deductible, is going to have a $350 deductible. So that is one of the benefits of that particular plan. My next plan is something from Clear Springs Health Premium. Now that's an unrated plan. That plan, it says it's too new to be measured, so it probably wasn't a plan offered in our state last year. It's pretty close to the other plan in price. And the next one is WellCare Value Script, and that is $19.70, $236.40. Now, if you're just interested in the plan based on total yearly cost, there's that other cheaper. We can compare them anyway, and let's just try that. I'm going to put this one down for a compare, and then we are also going to put the next one down. We can compare up to 3 plans, and we are going to compare them. And they both $50 deductible. One is $3 less expensive than the other one for the year. And when you look at this, here's another way to look at it. First WellCare plan has CVS in the standard in-network plan. You can see that is $488.40. Harris Teeter is only $240 for the year. That's one of the things you want to look at. Is the drugstore that you are going to use, are they in your network? Some of them will be even out of network. But if they have if they have a green check mark, they're at least in network, and you'll get less expensive. If there's a red X there, that means they are out of network, and those would be even more expensive. With the other plan, both CVS and Harris Teeter are in network, and they are preferred. So if CVS is where you want to go, then you're going to want this other plan for $236.40. If you can go to Harris Teeter, if it's equidistant, then your cheapest plan would be at the Harris Teeter pharmacy with that first WellCare plan. And then you can go to get your plan details. So here was the less expensive one. That was $16.90, and it's going to tell you that your preferred generic drugs have a 0 copay. Other generic drugs have an $8 copay, so you can learn about the drug plan. If you have a preferred brand, $40 copay, and if it's a non-preferred brand name drug, you're going to pay 46% of the total cost. So if the drug is $300 for a month, then you are going to pay a little less than $150. And then any drug that's considered a specialty tier drug, you're going to pay 26% of that. And we said we had the initial coverage phase, and then you would go into the coverage gap. When you get into that coverage gap, that means that you have paid $4,020 between you and the drug plan. So it's your out-of-pocket and plus what the drug plan charges you. Once you reach that, then you're going into the coverage gap. And that's when you're going to pay 25% for generic drugs and 25% for brand name drugs. So here's what you're going to be paying specifically for at the standard pharmacy: $8 for the atorvastatin, $8 for the glipizide, and $8 for the warfarin, costing you $24 a month. Here's your total costs for the drugs. At Harris Teeter, you're going to be paying $0 for each of these. So if it's not too inconvenient for you, you've checked it off as a possibility, then this would be a good drug for you. These are all considered tier 1 drugs there, as they were at the other pharmacy, but they're more expensive because the other pharmacy is standard and Harris Teeter is a preferred. So you need to look at these things. And then you can choose to enroll in any of the plans right there and then. So if you like this plan, you can hit enroll. Before you enroll, please be sure you also have your Medicare card with you. You'll need your number, and you will also need to know when you started Plan A and Plan B, and that will be on your card. It will tell you the month and the year. It's usually the month and the year that you turned 65. Also, when you enroll, you will be asked whether or not you want to have this taken out of your Social Security benefit. You can check that off. If you prefer to do it by credit card or by having it withdrawn from your bank account, then you will have to work with the drug plan that you choose, and they will give you forms. You can call them and ask them about that, and you can submit those forms and have the monthly premium deducted from your checking account or added to your credit card. So these are all the things that you need to know when you're going to be enrolling in a plan. It really isn't very hard. I think anybody can do it, and I think it's really worthwhile to check. One other thing that you can do is you can go back to comparison if you would like. Let's see if we can get there, and you can compare your plans, going back to our results. And there's a place where you can compare 2020 with 2021. Let's see if we can find that here. Usually you can do that. Here it is. You're viewing 2021 plans. Show me 2020. So you can click that on and compare it and see what those are like. Thank you very much for joining me, and hopefully you can find a good plan for yourself.